Welcome to EDU. We hope you enjoy working in the unit and find your time with us beneficial with regards to your development. The unit is a part of the emergency floor and has 12 beds and 2 chairs, plus a waiting area, with 2 patients for medically fit patients awaiting to see the mental health team. The unit is a part of the emergency department. This unit is staffed by an EDU dedicated team of nursing staff under Mag Platz, matron, and Simone Shivers, sister on the unit. There is a strong element of the teamwork in the unit, and this will be evident compared to those who have worked on traditional wards. It has an ED consultant as clinical lead, Mark Williams. The ED consultant of the week does a ward round each morning during the week and returns for a board row at 4 p.m. This may also ring up to check on progress during the day. Contact them if any problems. Better to do this than the problems build up and wait. In addition, Johnny Atkinson, ED consultant, will do the ward rounds on Monday and Wednesday mornings. EDU is covered 24/7 by a dedicated FY2. Out of hours senior cover is provided by ED senior medical staff. You will need to contact the EPIC, emergency physician in charge. Either go into the adjacent ED and find them, or they will be contacted on bleep 6702. If there is a medical emergency on the ward or a cardiac arrest, call 2222, which will summon the appropriate help. This team will include the EPIC, emergency physician in charge. Make yourself aware of where the crash trolley is on the unit and its contents. It's checked regularly by the nursing staff. Join them when they do this to see where the contents are. Note: PPE is in the bottom drawer of the crash trolley. There are several pathways. They are all available on Insight. You need to have a look through these. Any patient admitted on the EDU will first be assessed in the ED, and a pathway is completed and then signed off by the EPIC. A referral is then put on the nerve center after a handover conversation with the EDU nurse coordinator. This is designed to ensure patient safety and appropriateness for the unit. The patient is then admitted to the unit and their care continues. You will get a wide range of exposure to the variety of conditions. Things are missed in the ED. Conditions change, and you may find that you feel the pathway was not followed by the ED. Please discuss these cases with more senior doctor. Since COVID, the unit has also been taking direct referrals from the front door of the patients with mental health problems and minor overdoses. These patients need seeing in full and clocking with a management plan written in the notes. Do discuss these patients with the EPIC if any queries. One of the team is usually based on the unit, although they may be assessing patients on elsewhere. There's also a mental health assessment rooms on the unit and a sub-wait area for patients with mental health problems who are medically fit for discharge. Patients on EDU who require their input should be referred when they are fit for mental health assessment. This is in line with national guidelines and has been agreed with the team. See the mental health SOP, co-written with the team manager on site. For example, don't refer someone who is incoherent from alcohol intoxication, and do refer someone who's on NAC. Let the nurse coordinator on EDU know if any issues and escalate to the consultant on the unit or EPIC. Do try and join the mental health practitioners and see how they approach the patients with mental health conditions and do an assessment. You will be required to go to the UHL induction if not currently working in the trust. You will be then attend and complete the ED induction sessions, moved to mainly virtual this year, except for the pediatric sessions. Anyway, it's not relevant to the EDU. Rota, this will be sent to you. We have a very good junior doctor administrator who can give you advice and help facilitate flexibility around the annual leave. It is flexible enough that previous doctors have not had a problem swapping the shifts with their colleagues to allow flexibility with the annual leave. You will do shifts on the EFU. A rota for EDU is put on the notice board in the office. Study leave for the trust doctors. Limited study leave is allowed for the appropriate courses relevant to the unit and or your development. This needs to be discussed with your supervisor and Dr. Williams. The study leave should be rota is in for FY2s. Let me know if any issues. Non-trainees are allowed to go on to relevant teaching run by the department if this is practical. This needs discussion with their supervisor. Doctors are encouraged to take advantages of various resources on EM3. You will get a lot of one-to-one shop floor teaching from a consultant doing the daily ward rounds. When you're on the day shift, take advantage of this. There will be opportunity for you to do work-placed assessments on the ward round. Be proactive with this and discuss with the ED consultant doing the ward rounds. There's also a GP with special interest working on the unit part-time. That's myself, who is additional to providing the clinical supervision, facilitates workplace assessments. These are work-based placed assessment clinics provided by the ED. They are very useful to get CBDs. You need to book them via the educational team and can be booked via EM3. Do this early as clinics get busy, especially towards the end of the placements and ARCP time. Ad hoc mini teaching sessions do happen on the unit, and there are occasional in situ sims that are being developed. E3DU, Educational Extravaganza EDU, has been started. This happens on a Monday at 2 p.m. on the EDU in the MDT office. An opportunity to present cases, discuss these and various other topics. A list will be provided in the near future. You also get constructive feedback on your presentation skills. There's also been a great difficulty in docs getting their FY2 equivalent competencies in recent times, but needs you to be organized to do this. A large proportion of the EDU trust grades have gone onto the getting training course. Several pointers to working on the ward. Be on time for your shift. Not doing so really annoys your colleagues, especially after nights. Working with the nursing staff. Listen to what they are saying and ignore at your peril. Handover. Utilize nerve center and update this. This should be done in conjunction with the nursing staff. Morning handover. You will need to go through the notes and get organized for the ward round at 9 a.m. You should go and say hello to your patients and check no new issues or change in condition. If you're struggling with a patient getting a specialty brush off, investigation refused, seek senior medical help. This will be ED consultant during office hours and the emergency physician in charge of the ED out of these times. Early seeking of help is usually good for you, the patient, and the unit. Patients, when they come to the ED, they should have a clear plan. However, things are not picked up in the ED or change. Note review including looking at the ambulance sheet and reviewing the investigation must be done shortly after the patient arrives on the EDU. This is to ensure safety and correct ongoing management. Following above, you should introduce yourself to the patient. Patients do not need clerking on the EDU except the direct admission from the front door. However, all patients must have an entry in the notes within the first hour on the unit using the S-bar format. This will involve checking silent points of history with them and may include examining them. ED do miss things. Example, beware of missed trauma in the elderly that needs to re-examine shortly after arrival on EDU. The plan for the patient should be discussed with them to check they understand this and give approximate timing if applicable. For example, they may be waiting for a blood result or home. If this is okay, then it may take an hour or two. Any unexpected findings compared to the ED findings or plan should be brought to the attention of the EPIC. You should do a VTE risk assessment for the patients on the EDU via nerve center and is only a few clicks for a low risk patients. Explanatory information on the notice board and give someone to show you. Unwell patients on the unit. Except for the patients on end of life pathway, the unit is not designed for the ongoing care of the critically sick patients. Get senior help early if the patient deteriorates. Note the previous mention of calling 2222 for medical emergencies. The unit is usually very busy during the morning and you will have enough to do on it. However, at the time that is not always so, especially during shift overlap in the afternoons. At this time, it is worth going to the EPIC and asking if there is any suitable patients in the majors or assessment bay that you can help assess and take to the EDU. Note, you will not be expected to see any patients where it is not obvious that they are suitable for the EDU. There are many computers on the unit. All are tap in and tap off. Your ID badge will enable you to do this as well as get into the unit. You've tried to avoid having drawers full of bits of paper in the new EDU. Pathways and various useful forms are available via Manage Print. This is a touch screen that sits above the main printer in EDU. You will find this relevant bit of paper and print it. Office space. There are a couple of MDT offices on the unit with 8 computers. Do utilize the desk and the computer in the treatment room. Extension 6214. X-rays and CTs need to be requested on the ICE and task then put on nerve center. Escalate any delays to the consultant on the EDU or EPIC as applicable. TTOs. These are done especially designed templates on ICE. The trust won't let me make this any simpler. Give each other a hand with these. For example, if you're on a night shift and you have a patient who have recovered from anaphylaxis on the EDU, do the TTOs or start it. If you think it is likely they will go home following the morning round. This cuts down the pile of work for the day doctor post-ward round. TTOs are audited and spot checked, and GPs happily make aware of poor ones which will be fed back to you. TTOs must be done for all patients, including those that self-discharge and mental health patients. Note, the mental health patients who are seen by the MH team gets a letter from them. So keep our TTO letter brief. For example, admit with mental health problems. Separate letter will follow from the mental health team unless other issues are needed in the letter. An IT fix is to merge. This is not available at present. Sickness. You need to phone the hospital and speak to the Epic if you are sick. Available on bleep via switchboard. It is not acceptable to phone in 10 minutes before a shift or after the shift has started. Sickness will be managed as per the UHL policy. Please read on inside. You will need a return to work meeting post an episode of sickness or you won't get paid for the days off. This will be arranged for you. If you are worried about any patient, seek help. Drugs on the EDU are prescribed on the drug chart. You do, however, need to know how to use EPMA and complete the module on the HELM helm so that you can work on the EFU. Smile. It rubs off on patients and fellow staff.